I was just becoming sicker and sicker and dealing with a relentless cycle of ailments that doctors didn't seem able to connect. I felt I was being treated symptom by symptom rather than as a whole person. I became so fatigued and eventually started suffering from surging pain affecting my kidneys and bones. And you know, after years of living with all these symptoms, I finally got a diagnosis. I was told that I had an illness called primary hyperthyroidism, and that all these issues were caused by a growth in one of my parathyroid glands, right behind the thyroid. Unfortunately, when I was told that parathyroidectomy surgery was the only cure, this was a real shock to hear, especially as I'm sensitive to even the tiniest amount of anaesthetic. I felt so helpless. That's when I started some serious research. I needed to find out if there was any way of resolving this issue which would avoid surgery. And I was so relieved and comforted to talk to other women from around the world who had faced a similar dilemma.
He was really telling me, like, Jessica, you need to do surgery. I think this might be cancer. Like, you really need to consider doing surgery. And I'm asking him, like, okay, if I do surgery and I become fully hypothyroid, then what? Am I going to be on medications for the rest of my life?
I think whenever we get a diagnosis with the name of cancer, we immediately feel death at our door, right? And I was a young mother at the time of a young child, and I grieved a lot. The only alternative I was given was, well, in a couple of days, if you want, we'll sign you up and you'll be scheduled for your full thyroidectomy, thyroid removal.
I found out that I have thyroid cancer, and it was a big shock for me because I was just 25 years old, I think, back then. And at the very beginning, I did not want to do the operation. So I was quite scared from it.
Even though cancer is scary, like that word is very scary. And I know most people are like, cut it out, get it out of there. But I just didn't feel that way. I don't know. I just wanted to look for other options.
I got quite pushed by the medical establishment in the UK to do surgery and this time do a full thyroidectomy. This idea of living for the rest of my life without a thyroid, like ending up in hypothyroidism with medications, and for the rest of my day it's still, to this day, it's not really an option in my head.
It was through them and visiting a website called Save Your Thyroid that I discovered a fascinating alternative to surgery called radio frequency ablation. And although there are a number of doctors who do this surgical procedure, both in the USA and mainland Europe, all these women had been treated by a doctor in Germany. So I set up a Zoom call with this doctor, sent over my scan, and before I knew it, I was packing my bags and getting ready for a trip to Germany. But not without a certain amount of trepidation, I would say.
David, you could put this in, this is ready to go.
Hello.
Filmmakers, good timing.
Perfect timing.
In Dr. Korkusuz's clinic, I met other women from all walks of life who were also undergoing the RFA procedure.
I've traveled here from California to get treatment with Dr. Korkusuz. He has good equipment, a bipolar RFA, and so I felt like I could talk to him and he would answer all of my questions without making me feel like I'm rushed out the door. I think it's great for people to be aware that there are other treatments. You don't have to necessarily have your thyroid removed.
A lot of people treat nodules, benign nodules. There are plenty of doctors that will do that. There are only a handful in the US that will treat thyroid cancer. And when I spoke with Dr. Korkusuz, he was willing.
Yes. Sure, yes.
If it wasn't for the advocacy groups that she found, she wouldn't have found that there are advanced treatments out there. Her normal course of treatment would have been to have a thyroidectomy.
It was good. It was, yeah. It was not too much pain. I feel like my cancer's gone, right, doctor? I'm so glad to meet you.
Yeah, I do too.
I always like meeting Scots people anyway. Yeah, I love Scots. They're like my favorite people.
I'm so grateful to you.
Like Texas.
Oh no, I want to keep these organs.
Yes.
Yeah. Thank you, doctor. Goodbye. Goodbye.
Bye-bye.
Now it was my turn. And surprisingly, I wasn't as nervous as I expected to be. But I'm still a little bit tired, a little bit tired. I'm not 100%. Dr. Korkusuz carefully explained that bipolar radiofrequency ablation, or RFA, is a highly technical but minimally invasive procedure. It uses high-resolution ultrasound to guide the process, applying heat to the targeted tissue to destroy the tumour from within.
Yeah.
You can see the product is from there. It's going up.
Yes.
And the best part, only a small local anaesthetic is needed.
How is the pain, Maria?
I feel fine. This is just feels a little bit numb,
Yes.
but I feel okay otherwise.
Put a hand, yeah.
Oh.
Good morning.
Can you believe that?
No? What did I just experience?
What's that just experience? So you're happy about that? He's just a bit emotional because he didn't expect that.
Yeah. Wonderful.
Uh-huh.
Okay.
Yeah.
Lovely.
So I'm just going to ask you a few questions.
Okay.
Where do your patients come from?
Oh, my patient comes from Canada, USA. Luxembourg has a reimbursement. Holland has a reimbursement. Switzerland, Mauritius, Venezuela, Mexico, Russia, Turkey, and
How many patients do you think you treat per year with this ablation?
200, 300. And I started 2012, so I have treated something about more than 3,000 patients now. I treated, I think, hundreds of cancers now, and I have only 1 or 2 recurrences, not more. We have not long-term follow-ups to 10 to 15 years. That you have to know.
I can feel a little bit of swelling.
Yes.
And a little bit of discomfort, but not painful. When I caught up with Gina and her husband a couple of days later, seeing her smile and hearing her feedback was the ultimate proof that RFA was obviously the right choice for her.
I feel so much better. Yes.
Wow.
Yeah. Yeah, it's hard to believe. Like I almost can't believe it myself.
the fact that 30 minutes or an hour after the last procedure, she was happy. Really incredible transformation.
It's really heartwarming to speak to these patients because they say that they've never met a doctor who's as caring as you.
Really?
Yeah.
I give him a pass.
He was incredible. It was the first time that a doctor ever sat with me for an entire hour, listened to my story. He was telling me it's your choice, ultimately, what you want to do. And I appreciated that too, because he wasn't pushing for me to do RFA. He was giving me the choice. And what's really amazing is when I went for my ultrasound this year, I saw that it had shrunk 99.85%. I did a second ultrasound like 2.5 months ago, and she's like, I cannot even see anything. She's like, your nodule is like essentially not even there.
It's been quite a journey, but a journey that has completely changed my life and has opened me up to possibilities that I did not know existed. I just got another ultrasound recently, which would be like a year later. The radiologist here was also very happy to find nothing. I would have traveled the whole world again just to receive these news. I'm just grateful for Dr. Korkusuz, but also grateful for myself because I found him.
It's like so painless, and even the recovery was great. And I believe he also offers RFA for certain types of breast cancers. I really hope that in the next few decades, like, things will change and this will become more and more accepted as a reliable treatment.
Now whatever is left here is actually a dead tissue, and it gets smaller with time. If he thinks that RFA might not be the best option for you, he would just tell you. That's something I also like about him. He's very honest.
I was so excited just to have an option. And I know it's not like a 100% guarantee, but to me, it was just like you said, it was hope for something that I wanted to try. Before you could see a lump in my throat, and now you can't. It took me 8 years almost to find Dr. K, but I'm glad I did.
Back home, I felt so much better after my procedure, and my blood test results were very encouraging. My husband David was very supportive throughout this process about my choice and about travelling to Germany. In fact, he did most of the driving.
I've had worse times at the dentist.
As I reflect on this journey, I can't help but ask myself, what was the common thread that brought all of us to the door of Dr. Korkusuz? Where did we find the courage to stand up for ourselves in spite of all the scepticism and overwhelming opposition from the medical community? Perhaps it was because our intuition became stronger than the voices telling us that we had no choice.
I think when it comes to choice, you have to remember that you do have a choice. It's your body. You're living in it. No one else is.
It was the first time I feel like I really spoke up for myself and advocated for myself.
It's your body, your decision. You know, you do what you think it's right.
I think I've made a new friend in Dr. Korkusuz, but I think all these patients would say the same thing.
And this is the future, I think. Yeah.